Hello,
So,
doctor.
do you remember the symptoms with which you came here, especially with the shoulder?
Yes, I was diagnosed with partially ruptured tendon profoundly
Of the left shoulder.
of the left shoulder. Yes.
And what was the symptoms?
In the beginning, it was something insidious.
So it was a severe pain.
It's all pains, but in the beginning it was not permanent. Just doing some special movements, I felt very big pain, but otherwise I could continue my life. It was 3 years ago when it started.
Okay, so you had any injury?
In the beginning I didn't know. They said tendinite.
But did you fall down or you had any sudden movement? Why this rupture happened?
No, I just reached the age of 55, 56,
And you used to do a lot of exercise.
about 60 years old.
And you used to do a lot of exercise, yoga exercise.
Yes, but in fact, my body changed, I think, and what I did before, later by later, I couldn't because this problem of shoulder. I had it also in this.
Okay, so then what were the treatments done in Europe?
The treatment they prescribed was 3 months ago. I suddenly couldn't move my arm. It was very.
You can't lift your arm?
Yes, I couldn't. It was very cold, and kine and yoga teacher went for holidays, and as there were 2 weeks without exercise and very cold, and 3 months ago my arm can't move anymore because too much pain, because from the beginning 3 years ago it slightly increased very insidiously, but it increased really. In fact, it could never heal alone.
So the pain slowly increased, and when you arrived here, you had continuous pain.
Night and day.
So can you explain that condition?
Yes, it was a very painful night and day. It started about 2-3 months, so I couldn't move my arm, and in fact I couldn't. The more I couldn't move, the more I couldn't move. In the beginning I couldn't move much, but at the end I couldn't move at all. Even when I made exercise before, it was very painful. But when you stopped to do any movement or exercise, it will become worse.
Okay. So they did some intra-articular injections, and what are the other therapies they suggested?
They made the first injection, and the specialist said it will improve, and then at the end of the month, 1 month later, if there is just little pain continue, then I will prescribe you another injection under radio, and it will be to break the calcification on the tendon, and taking it off your body. You will have it, but in reality there were no improvement at all, nothing improving. It was worse and worse and worse. And fortunately, I had planned to come in Sreekrishna for my general health, and then I arrived to Dr. Vijit with that problem to address.
Yes. So, and now, how you feel after the treatments now?
Now I feel perfectly okay. After that treatment. It was, I spent 5 weeks in Sreekrishna. At the end of the 3rd week, it was very much better. And after the 5th week, I feel very, very well.
So now there is no pain?
No.
No. Can you lift your left arm now?
Yes, I can.
You can lift, yeah. Okay. So you lift and move without any pain?
Yes.
Yeah. Okay. So what do you want to tell to the world with this experience?
I'm happy to notice the world that there is something to do with taking care, just taking care. With first they used here the leech therapy. The leech therapy in my remembering took off 50% of the problem. Even if you touch me just with the finger, I cried, so it was painful. After leech therapy, there was release, so it was great.